called finger feeding. It is absolutely the most fabulous tool to getting a baby to learn how to breastfeed properly. The first thing the mom's going to do is, of course, wash her hands and cut her fingernails. Tap the baby's bottom lip until he opens and puts her fingers directly into the baby's mouth. I want to make sure that the baby's top and bottom lip are both open around the finger. I place the baby to the right of the mother so that the mother feels safe and isn't afraid she's going to drop the baby. Okay, so the right hand is in the baby's mouth. You can see that the baby takes the mom almost to the second knuckle in the finger. Now we'll pick up the dropper. The mom places the dropper right next to the finger. I personally use a glass dropper because glass tastes better than plastic, and it's got a little beautiful tapered tip, and you put the tapered tip right next to the finger. The mom drops consistently. The baby feels the skin, and the baby's tongue is flat like a piece of wood, just like the tongue needs to be during breastfeeding. Go a little bit faster. There we go. There we go. Perfect. Pick up some more milk. Excellent. And go drop, drop, drop. Perfect, perfect, perfect. Great. Put the dropper in a little bit deeper. Great, perfect. This is called finger feeding. Wonderful. And again, pick up the dropper and go ahead and drop consistently. Perfect. I want the dropper to be dropped in consistently because the breast sprays milk consistently. The breast goes spray, spray, spray. So I want the baby to feel that constant spraying of milk. Great. The mother's going to put a teeny bit of counter pressure on the baby's tongue, not a lot. I don't want the finger living up in the roof of the baby's mouth, although the baby pushes it up there for comfort, but a little counter pressure on the tongue will have that tongue then respond and make a peristaltic movement. It's the peristaltic movement that most of these babies are missing when they're not breastfeeding well. Gorgeous. 99% of all my babies love finger feeding. They're really happy, they're really content. Moms can do it, dads can do it, grandparents can do it, any other caregivers that the mother and father feel safe with can do it. The babies are very relaxed, calm. I do this with a lot of my premature babies, my little babies that come out of the hospital being 4 pounds and they haven't quite learned how to use their oral cavity properly. They're always calm, relaxed. I find that these babies like finger feeding a lot more than bottle feeding because it is the most similar experience to breastfeeding. When we finger feed the baby, it teaches the baby 3 very important things. Number 1 is that skin gives milk. Number 2 is that the tongue needs to be flat like a piece of wood. Number 3 is that the baby needs to pull the nipple between the hard and soft palate.